Hi, I'm Misty Wilkin, nurse educator, scientist, and certified specialist in poison information. I want to bring awareness to our services and discuss calling the Poison Center and first steps in caring for the potentially poisoned patient. Specialists in poison information, like myself, are medical professionals such as nurses, pharmacists, and providers. We specialize in the field of pharmacology and toxicology. Toxicology is defined as the study of the adverse effects of chemical, physical, or biological agents on people, animals, and the environment. Your learning objectives are going to be recognize what is considered a poisoning, understand the Poison Center as a resource, know when to call the Poison Center, and understand the first steps in caring for the poison patient. You can see here to the right America's Poison Center's new logo. The number is here as well, same number nationwide. Our calls or the Poison Center calls in this country are routed based on the caller's area code. So if you call from a phone in the Southeast Texas area, which is going to be your local poison center, the Southeast Texas Poison Control Center, and we are located in Galveston, Texas. So what is a poisoning? Poisoning is defined as the harmful effect that occurs when a toxic substance is swallowed, inhaled, or comes into contact with the skin, eyes, or other mucous membranes. A few examples, as you can see here, chemicals, plants, drugs, and venoms. To get an idea of the types and number of calls poison centers receive, let's take a look at some data. The National Poison Data System, or NPDS 40th Annual Report. This report comes out once a year in the Journal of Clinical Toxicology, and the report contains data gathered by the United States or our US 55 poison centers. When we get a call, we open a chart and we enter all the information on the exposures, and that is compiled. So what we're looking at here is the top 10 single substance human exposures of 2022. And this data is pediatric as well as adult combined. So the combined exposures, I have them in order here of the number one or the top exposure or the top human exposure in adult and children, all the way down to number 10 here. So number one, as you can see, I'll quickly go through them, is analgesics, which you can see is a very large number, 186,000 around there. And that includes medications such as acetaminophen and ibuprofen, just a few examples. And then going down to number two here, or the top two, or the second top exposure in the US is household cleaning products. And you can see here that's a big number as well, 158,000 or so. And that's going to be things like, or products like bleach, Lysols, laundry detergents, those kind of products that are usually, not always, but usually accidental ingestions by children. Number three is going to be your cosmetics and personal care products. Those products as well, it's primarily children that are curious and they're getting into and eating things like chapstick and lotion and sunscreen and any products you can think of, lip balms, lip glosses, eyeshadows and mascaras, all those kind of products. Number four is going to be foreign bodies, such as things like toys and miscellaneous things that usually, again, kids are putting in their mouths. Right now, some trending foreign body exposures we're seeing is going to be things like water beads, those little polymer beads that they're using now in little toy guns, and batteries, specifically button batteries. Those can be dangerous for anyone that swallows those. And then moving on to the next, number 5, is going to be antihistamines. Just a few examples that we see a lot or get a lot of calls on. Diphenhydramine, loratadine, getting a lot of double doses or wrong medicines giving, or even a lot of abuse and suicide gestures with especially diphenhydramine. Next on the list, or number 6, is going to be dietary supplements and herbals and homeopathics. And a few trending exposures that we're getting on those is melatonin, especially the gummies. The 2-year-olds love the gummies, or children in general. If they want something sweet, they'll sit and eat them by the handfuls. And then, of course, we're getting a lot of diet products or diet drinks, or those kind of products. People misusing those or accidental ingestions. And then number 7 on the list is pesticides. A few examples of those are your roach sprays and your ant powders and those things that people misuse or children get into. And number 8, a lot of antidepressant cases or a lot of antidepressant exposures. A lot of these, unfortunately, are mostly suicide intent, or a lot of what I see is suicide intent. Of course, there are accidental exposures as well. A few examples of those are going to be like fluoxetine and duloxetine. And then number 9 on the list are going to be your topical preparations, such as steroid creams and anti-itch creams and triple antibiotic ointments. And number 10, finally, is going to be vitamins, especially gummy vitamins in children. We do get some minerals. Again, the gummy thing with them looking, tasting like candy. Usually not a problem unless there's iron, but we do get a lot of those. Now that we have discussed some of the types of calls we receive, which I'm sure you've seen many of these in your own emergency rooms, I would next like to discuss why it is important to call the Poison Center as a resource. We provide accessible and affordable healthcare support. We are medical professionals available 24/7 to help you care for your poison patients. We are fast, free, confidential telephone consultation. We also provide that toxico surveillance I was speaking to you about earlier. Poison Centers auto upload data on poison exposures to the National Poison Data System on average every 9.5 minutes, which allows for real-time detection of surveillance anomalies and events of public health significance. We offer public and professional education. Poison centers provide professional education to medical students, medical residents, and fellows in toxicology fellowship or training programs. And we also do drug and product safety research. The NPDS data can be used to monitor the safety and clinical effects of new medications, chemicals, and emerging drugs of abuse. Poison center data are used to identify needs for defects in packaging and medication formulations and monitor recalls and public health interventions. Just a few examples here of some things we're seeing. Of course, we're seeing more and more of the fentanyl exposures. We have collected data and information, and we now know things like, they're using the fentanyl to make fake oxycodone, and it looks the same as a oxycodone pill, and they're even marking it with the M10 imprint. And we can bring that to awareness. And one big talk point or hot topic right now, of course, is these water beads. A matter of fact, because of a pediatric death due to a bowel obstruction, some of our major retailers are now stopping selling these products, water beads and water bead products. In order to best care for your poison patient, I want you to know when to consider calling the poison center. These would include exposures involving ingestions, eye exposures, dermal exposures, and aspirations, unintentional medication ingestions, and intentional medication overdoses, insect bites and stings, envenomations, chemical exposures, medication errors, drug-drug interactions, indications and dosage, and lastly, and most importantly, we can help you care for your unknown or potential exposures of unknown origin. Based on sets of symptoms, we can sometimes even help with patient diagnosis. Okay, now that you know what we do and when to call us, next I want to discuss the first steps in caring for the potentially poisoned patient. First, we start with the basics: airway, breathing, and circulation, and of course, good symptomatic and supportive care based on patient presentation. Does the patient need to be intubated and ventilated? What are the vital signs? Do they have a good blood pressure and heart rate? What does the EKG look like? Do they have prolonged QRS or QTC intervals? When performing assessment and diagnosis, especially on an unknown exposure, it is important to recognize and understand sets of symptoms that are commonly seen with a drug class or type of exposure. These toxidromes can give us clues so that we can better treat the patient with an antidote or proper supportive care. Assess: what is the patient's mental status? Are they sedated or agitated? What is their temperature? Are they hyperthermic or hypothermic? And have they had any seizures or rigidity? Once you have assessed and hopefully stabilized the patient, the next step is to call poison control so we can discuss the patient exposure and assessment findings to help determine whether the patient is a candidate for decontamination or elimination procedures such as washing, diluting, activated charcoal, lavage, whole bowel irrigation, or hemodialysis. We can help your team decide what treatments may help, what antidotes may help, what treatments you should avoid, and what labs need to be ordered or drawn. Common labs include osmolar gap, anion gap, renal and liver function tests, acetaminophen levels, salicylate levels, CBC, CMP, urine drug screen, and ethanol levels. Also, with some exposures, the patient may also need a chest x-ray or abdominal imaging. As we just discussed in patient assessment, it is important to recognize toxidromes in caring for potentially poisoned patients, especially when there's an unknown drug involved. Here are some common toxidromes, or just an example of what I mean by toxidromes. The sympathomimetic toxidrome. You can see this toxidrome when you have something such as a methamphetamine overdose. Of course, you're going to see everything: increased energy levels or agitation, decreased pupil size, increased heart rate and blood pressure, increased respiratory rate. They'll be sweaty, increased or hyper bowel sounds, and hyperthermic. Can be hyperthermic. Hyperthermia can be a bad thing when dealing with sympathomimetics. Just another example here, going down to kind of the complete opposite. With opioids, of course, you're going to see lack of energy or sometimes excessive sedation, uh, pinpoint pupils or miosis, decreased heart rate or bradycardia, blood pressure can be down, hypotension, decreased respiratory rate, all the way to respiratory depression or arrest, lack of sweat, lack of bowel sounds or decreased bowel sounds, and the temperature can be down. And then, of course, going all the way down here or they're going down to sedatives. Of course, everything is going to be, decreased or down, and down here to serotonin syndrome. Everything is increased energy, mydriasis or dilated pupils, tachycardic, hypertensive, increased respiratory rate, sweaty, increased bowel sounds, and temperature. Okay, so here's an example table of a few common exposures and their antidotes. There are a lot of antidote tables out there. As a matter of fact, the State of Texas Poison Center Network has a nice antidote chart that you can request for your pharmacy or for your ER just by going to www.poisoncontrol.org. I just put a few of them here as an example. I just wanted to just discuss a few of those with you. We saw that there were a lot of analgesic exposures that we receive in the poison centers. Acetaminophen, I see a lot of those. We can help you manage those or determine, do you need an antidote? We're going to request some labs. The timeliness of the acetaminophen level, something we take into account. When was the lab drawn? We can look and determine, hey, is this potentially going to be a toxic exposure? If yes, then we'll recommend the antidote, which is going to be usually the IV acetadote, also known as N-acetylcysteine or NAC, and also known as Mucomyst. And then also aspirin exposures. We can help you determine at what salicylate or aspirin level would you initiate urine alkalinization. We can discuss how to do the bicarb drip and when you need to check the labs, the salicylate level, electrolytes such as potassium, urine pH. We can help you manage those patients. And exposures such as opioids. Of course, your Narcan, you're going to want to watch your patients 6 hours post Narcan dose, just so that you know that the drug is not going to last longer than the Narcan does. Just little tidbits like that. Pit viper envenomations. When would we recommend an antivenom for what symptoms or for what labs? How much antivenom? What to watch for at the bite site? Or some things that we talk to y'all about when we get calls, snake bite calls, and of course toxic alcohols. We can help you determine, at what point would we start the fomepizole or the antidote? When would we stop? What labs do we need to check? So just an idea of what we talk about when we're talking about the antidotal treatments. So the last thing that I wanted to discuss here is going to be tips for when you call the Poison Control Center for guidance in patient care. So when giving us reports, I just wanted to just discuss this common mnemonic, just so we have an easier, smoother discussion about the patient. Just have the patient demographics ready, the name, the birth date, the medical record number. Be ready to discuss the patient's situation and background. What happened? Why did it happen? Are they on other medications? Maybe even some of their pertinent history. And then we want you to, or we'll ask you to report your assessment findings just to help us determine what's going on as well. What are the vital signs? What are the lab results? What are the EKG results, if any of that's available? If not, we'll make recommendations on what you need to check with regard to that. And then based on the information we have, we'll make treatment recommendations or lab recommendations and go from there. And then on your end, as you know, the caller, you are going to want to document our recommendations, and you're going to want to get our name. You're going to want to get a case number, because we do create a case for every call we get, and that just helps you um, for your documentation, so that if someone comes behind you, they can call us if they want further recommendations, and they can easily give us a case number. And then you also have that for your record. Thank you. Just a quick list of my references and a few resources. The antidote chart that I discussed with you is a picture of it here. I think we have changed the logo, but you can request that, like I said before, at poisoncontrol.org. There's our phone number, America's Poison Centers, again, the 1-800-222-1222. And another resource for you, if you want to learn more about toxicology, a little tutorial, it's ToxTutor.